My name is Sierra Sabo, and I have decided to do my project on syphilis, also known as the Great Imitator. The reason why it has this name is because the signs and symptoms can imitate other diseases, and it is very hard to pinpoint. So first I'm going to talk about what is it and how is it acquired. So how do you get it? What is it and how do you get it? Syphilis is a sexual transmitted disease. It is a bacterial infection and is most commonly spread by sexual contact. However, you can also get syphilis by just having skin-to-skin contact with someone who has syphilis and has a open sore. So syphilis will usually start off as one sore on a person's genitals, rectum, or mouth. Those are the most common areas. So syphilis is caused by bacterium called Tranamypallidum. It is a spiralocytic bacterium, which means it is spiral or it's coiled. It is also a gram-negative bacterium. So it can produce an extremely destructive lesions on any part of the tissue on the body, including the brain, skin, heart, internal organs, bones, anything of that. Next I'm going to be talking about cultured and isolated. It is extremely hard to be cultured. And isolated is only happened a very few times, and the reason for it being so hard to grow and to culture is because it has different strands, and each strand requires a different thing. So some strands will require long chains of fatty acids, and others will require branched chained fatty acids. So it's very hard to culture them. So it has 4 stages, sometimes 5 if you let it, get that far if it goes on for long enough. Stage 1 is called the primary stage, so it's primary syphilis. Primary syphilis is basically whenever you get a sore on the mouth, anus, or genitals. So it is usually the sore will just generate in any area that the bacteria has, entered the body in. So just mainly cavities. These sores are very similar to canker sores, or they look very similar to yeast infection sores, to herpes. It's very hard to pinpoint. So, and it usually will last to about 3 to 6 weeks. Now, if these go untreated, it can turn into stage 2. Stage 2 is secondary. So secondary syphilis occurs with sores. Whenever the sore is already healed, it can happen a couple weeks after it's already healed, or it can actually happen in the healing process of whenever you get those sores, like in your mouth and your genital area. So a rash will develop on the palms of the hand. Palms of the hand and the soles of the feet. It can actually happen anywhere on the body, but it's most common on your palms of your hands and the soles of your feet. Sometimes people won't even notice that they have a rash just because of how faint the rash is. It doesn't itch, but you can experience a fever, headache, swollen lymph nodes, all that during this period. And it will usually last to about 2 to 6 weeks, or it can come and go for even up to 2 years. So stage 3 is a latent stage. This basically means that you don't have any signs or symptoms of syphilis at all. You won't experience any type of rashes or sores, anything like that. No visible signs or symptoms of the disease. And this can actually range from 1 year to 20 years. There have been several cases where it has happened up to 20 years. Stage 4 is territory syphilis. So basically this type of syphilis, or it's stage 4, so if you go untreated, even after secondary, it can turn into the territory. So this stage is not something that most people experience because a lot of people go and get it checked out before it gets this far. But however, whenever it does get this far, it can cause it's extremely harmful to the body. The blood vessels, heart, brain, the nervous system, all of that, it affects all of it. It will actually start to damage your internal organs. Usually it will show up from about 10 to 30 years after your first experience with syphilis. So after your first sore, this will usually happen within 10 to 30 years. Now, if you continue to let it be there and you don't receive any type of treatment, it can actually go into your nervous system and even into, your eyes, your brain, all that, and it can form all kinds of different diseases. So, neurosyphilis and ocular syphilis. It can happen actually during any stage, but it's most commonly whenever you aren't being treated for it and it gets all the way to territorial stage. So this is whenever, or the neurosyphilis is whenever the infection spreads all the way to your brain. And it can cause several different problems like dementia. It can even paralyze you, give you migraines. And whenever it is ocular syphilis is whenever the infection has reached the eyes. This can cause redness, blurry vision, and even blindness. Now the left side is a picture of ocular syphilis and the right side is neurosyphilis. So signs and symptoms. So the signs and symptoms, I'm just gonna put them in the different stages because there is so many signs and symptoms of syphilis. It's extremely hard to pinpoint just a few to name out for that specific disease or infection, excuse me. And so the primary, it would be sores on the mouth, anus, or genitals. The secondary, it can lead to rashes on your body, most likely the palms of your hands and the soles of your feet. It can give you swollen lymph nodes, headaches, and fever. So the latent would be no signs or symptoms, and the territorial will be lesions all over the body that are just really deep and can damage all the internal organs and external organs. It can lead to damage of the heart, blood vessels, liver, bones, and joints. And the neurosyphilis can lead to dementia. These are all like the symptoms and signs. Would be dementia, abnormal walking, numbness, headaches, seizures, dizziness, confusion. The ocular would be redness, blindness, and blurry vision. And the last two, the neurosyphilis and the ocular syphilis, they're not actually part of like a stage. There's really only 4 stages. But I went ahead and included them anyway because I felt like it was important. So the diagnosis. If you already have signs and symptoms, you should go ahead and make an appointment with your doctor as soon as possible. Even if it is something just as simple as a yeast infection, you would still like to know that so that make sure that it doesn't get any worse than what syphilis can actually lead to. If you let syphilis take over your life, it can actually kill you. It can break down your organs enough to where you don't have function and experience all the signs and symptoms as I've listed before. So usually whenever you're diagnosed, like I said, it's very hard to diagnose. So they'll usually do a blood test, and they'll test for the antibodies that are in your body that your body produces to fight off syphilis. And if those are present in your body, then it is confirmed that you have syphilis. However, if you have problems with your nervous system, they will do a spinal tap, and they will take cerebral fluid from your spine, and they will test that and collect a sample to test to see if they can find whether or not you have syphilis. So if it does come out that you have syphilis, the best treatment possible would be penicillin. Usually, if it's something that is caught extremely early on, they'll just give you a pill. But the most common, because it is hard to catch on into, and sometimes you'll be in a second stage or a later time of that first stage, and it's required to have an injection because that's has been proven to be the best solution. So you can get an injection of penicillin, and it only causes one injection. Unless you get past the secondary stage, then you can have multiple injections in order to cure your syphilis. So after you get the injection, you'll undergo tests just every couple of weeks and exams to make sure that you are clear of syphilis and that the treatment is working properly the way that it is, and whether or not they need to up your dosage. It's also evident to not have any sexual contact until the infection is cured, because you don't want to infect anybody else. Even if you don't have signs or symptoms, it's best to go ahead and just stop all sexual activity until it's cured. Lastly, let your sex partners know. If you've had multiple sex partners, or even just one sex partner, you need to let them know to make sure that they don't have any signs of syphilis, because like I said, it's very hard to catch on, and to make sure to have that information is very valuable to your partners. Now, prevention. So the best possible thing is to just not have any sexual activity at all. That's the best way to prevent from getting any STD, really, but especially syphilis. And if you do decide to have sexual relations with people, it's best to be monogamous. So to have one partner, and to only have one partner and not multiples. Make sure to use condoms, avoid drug use, and just do regular screening to make sure that you're clean and healthy. Alright, and that is my presentation on syphilis, and I hope that you enjoyed it. Thank you.